Good morning, everyone. I hope you can hear me. I think you can. Welcome to the 8th parallel session of the Urban Resilience in a Context of Climate Change Conference. I'm delighted to be the moderator of this session. Let me present myself first. My name is Judith Libchaber. I'm actually the director of an urban innovation program here in Barcelona, working with cities, corporates, and startups in the improvement of urban services. Today, I will be the moderator of this session, and this topic is obviously of high interest to me, but I guess, and especially concerning today's situation, it should be of interest to everyone. Today, we are going to talk about how climate change will impact our public health in urban areas. Basically, we're going to try to answer a few questions of, has climate change already started to impact our public health, or will it impact it in the future? Is it going to impact everyone in the same way? Or few countries will be able to adapt better than others? And in order to answer all those questions, today we have four speakers. Four speakers who will give us a different perspective of the same issue. We will first start with Joan Ballester, researcher at the Barcelona Institute of Global Health. He will tell us about a project he's been involved in, more specifically a tool that he's worked on to develop called Early Adapt, which aim is to identify the capacity of adaptation of each country and each socio-demographic groups in relation to climate change. So we will understand with him where each country stands and what each country can do to actually adapt better. Then he will leave the floor to María Guerrero, project manager and researcher at CITAQUA, Water Technology Center. And she will give us a specific focus on two cities, Barcelona and Badalona, and how the water issues actually impact the vision of the city from its own citizen and business owner. More specifically, what happens when sewer overflows are affecting the city indirectly and intangibly. María will leave the floor to Marcos Quijan, also working as a researcher at the Barcelona Institute of Global Health. But Marcos will tell us about a study that has been undertaken from the 1987 till the 2016 on the relation between heat and mortality. So how has the heat waves affected mortality, and will focus on neighborhoods and social economic groups as well of the city of Barcelona. Finally, we'll leave the floor to Sebastiaan van Herk, director and partner at Bax & Company, an innovation consultancy. He will explain to us the close relationship between urban planning and healthy cities, and we'll try to understand how better urban planning measures can actually bring healthier cities. If you have any questions, I would ask you to keep them at the very end, because each speaker will have 15 minutes to speak, and we will at the very end have 25 minutes dedicated to the questions and answer. So if you are fine with that, we're going to start with Joan Ballester, who's going to tell us about the Early Adapt project. Joan, you can start.
Thank you so much, and thank you for the opportunity to present this project. The project is called Early Adapt, Science of Early Adaptation to Climate Change. It's funded by the European Research Council. It's a ERC Consolidator Fellowship. It's a 5-year project, and the main objective is to understand the environmental, socioeconomic, and demographic factors that explain the recent trends in human health, and also to infer projections for the future. So I will briefly, this project is about to start, but first I will show some previous results that have motivated this project. And then I will show the methodologies, the data sets, the types of analysis that we'll be doing during this 5-year project. So in a way, it's to provide some visibility to the previous results and also to the research that we are going to do in the next years. So the project is motivated by several studies that we've been publishing in the recent past. The first one is this one, in which we analyze the relationship, the vulnerability to heat, so the relationship between the risk of death and temperatures. This is for summer, for example, and we analyze the vulnerability to heat by time, so during the last 3 or 4 decades in Spain, and we saw a decrease in vulnerability to heat in summer. That's the plot on the left. On the right, we have instead the attributable fraction, which is a measure that shows the fraction of deaths that are attributable to this vulnerability to heat. And this is shown in the green line, which doesn't show any significant trend because it's the combination of the decreasing vulnerability to heat over time, but the increasing...
Joan, yep. I'm so sorry to interrupt you. It looks like we can't see your screen.
No?
No.
So what should I do?
Are you sharing your screen right now?
Yes.
Okay, maybe the access hasn't been given to you. Can we make sure that the access has been given to Joan? Okay, looks like it's been checking.
Now?
Right now we can.
Okay.
We can
go. I think there was something I was doing wrong. Okay, so it was this figure. Essentially, the one on the left is this decreasing vulnerability to heat. The one on the right, the green line, is the evolution of the attributable fraction. So it's the combination of this decreasing vulnerability to a given temperature in summer, plus, not plus, but a combination of this factor with the increasing temperatures. So what we see is that in a way, the decreasing vulnerability, this process of adaptation, has compensated the increase in temperatures, at least for Spain, during the last decades. So this process of adaptations has some role, but we should warn that this decrease in vulnerability would have led to a decrease in the attributable fraction if there was no warming. These changes can be analyzed by other causes of, by age, by sex, and different causes of death. Here, there are a couple of more studies about cardiovascular diseases and respiratory diseases, and the behavior is very different in one case and the other. For example, this is shown not only for summer, but also for the whole range of temperatures. So to the left, the left part of the XY axis corresponds to cold temperatures. The right side is the warm temperatures. And for cardiovascular disease, there is a linear decrease in the vulnerability to both heat and cold. But for respiratory disease, we don't see this kind of pattern. For respiratory diseases, there is a very strong decrease to cold temperatures and a very small decrease in the vulnerability, the relative risk of death to warm temperatures in summer. So the adaptation is not homogeneous. It's not occurring at the same pace for the different causes of death, for the different age groups, for men and women, etc., and causes of death. Another, this is important. One of the limitations of these studies is that they take into account only one or very few environmental factors. So the associations are limited to this factor because there are multiple factors that can explain this vulnerability to the environment. It can be temperature, it can be different air pollutants, it can be natural mineral dust, desert dust from Northern Africa, it can be also influenza. So these factors analyzed separately, they can lead to some estimates, but if we take them into account all together, these estimates probably are going to be smaller. And when we try to analyze the trends in these attributable deaths, we can only do it if we take all these factors together, because otherwise we might overestimate the attributable mortality. And regarding the trends, it is not possible to know if it would be a decreasing trend or an increasing trend. So that's one of the motivations of the project. Another motivation of the project is the role of the socioeconomy and the demography and all the factors that are not purely environmental. We published last year a paper in which we analyzed the trends in heat attributable mortality. So the green line I showed before, but in this case for Europe, and the growth in GDP, so in gross domestic product. That's a macroeconomic index showing the growth of the economy. And we found a close association between the factors, these two factors. But again, we are limited by the number of factors that we can take into account. And so, for example, we should include air pollution, we should analyze other factors like occupational accidents, unemployment, bad habits like alcohol, tobacco, etc., which might modify this modify this association between these factors. So the hypothesis of the project is that early adaptation is different for the different populations. It's not the same in Northern Europe than in Southern Europe. It's not the same for the rich and the poor. It's not the same for men and women. It's not the same also between, for example, within a country, between rural and urban areas. And so the objective is to understand these differences and to quantify the drivers that are explaining these differences, not only in current differences in vulnerability, but also in the factors that will increase these differences. So the drivers of adaptation inequalities. And so the basic approach of the model is putting all these factors together in one unique model so that we can have more realistic and probably more conservative estimates of the burden and vulnerability to each of these factors. So by taking into account the environment, the socioeconomics, and also the demography. We will, well, first we'll create a data set that I will explain in, we are already creating this data set, and I'm going to explain that in the next slides. After doing that, we will first do a first step in which we will model the association between the environment and one given health outcome. In this case, this is the example for mortality. Then we will, and with that modeling approach, we will estimate the vulnerability to the environmental factor and also the health burden, so the attributable mortality. Then we will use the socioeconomic and demographic factors, and we will associate these factors with the vulnerability estimates. So what's the role of the demography? What's the role of the aging of the European societies? What's the role of access to education, public health expenditure, these kind of things. And we will analyze these factors, these socioeconomic factors at the scales in which they are relevant. So for example, air pollution at the local scale, at the urban scale, or for example, the the GDP macroeconomic factors at the European scale. The scales in which these factors can be more easily studied and better understood. And then if we find associations between these factors and the trends in adaptation, then we can use the projections in these factors, in these socioeconomic factors, to provide more realistic estimates of the future evolution of adaptation. For example, if we find that the demography is an important factor for the adaptation inequalities, and we know and we have projections of demography, which is available, of course, then we can do more realistic adaptation projections. The database is the first step that we are doing now. The database will include multiple health outcomes at different scales. This includes mortality, occupational accidents, pregnancy, outcomes, including births, and also occupational accidents. The environmental factors are the most common ones studied in the literature: climate, different air pollutants, desert dust, and influenza-like illnesses. Here we can include COVID also. And finally, the socioeconomic variables, they can be obtained, well, they represent the socioeconomic inequalities in the society, and also the demography, like the gender gap, the Gini index, etc. And with this, this database will be available at different levels. The first level is the European dataset. We are currently using a limited data set representing 16 countries. We are going to expand it, much better resolution, so smaller units, longer periods, more population represented. With this objective, we will be able to analyze the spatial scales of the processes or the drivers, socioeconomic drivers, and to see how they are relevant across the boundaries of the countries. So if there are differences, for example, between southern France and northern Spain. There are other scales, countries, regions, and cities. That's one of the main important objectives of the project. And we'll start with database that we already have available at the institution for Spain with microdata representing mortality, morbidity, and births for all the cities, all the municipalities in Spain. And also from Catalonia, which represents all the basic areas of health, which in Barcelona it will allow us to do very small scale analysis. We'll try to replicate that through network of contacts or by getting new data sets in other countries so that we can do comparisons between, for example, Mediterranean cities, Southern Europe and Northern Africa, or Northern Europe and the Mediterranean, for example. This is something that one of the next speakers, Marcos Quijal, maybe will give more details about some previous results that we have already done at the local scale. But to analyze the climate at the local scale, we can use urban climate models. That's the result of a collaboration with the Barcelona Public Health Agency, in which we analyzed the associations between heat and mortality in Barcelona, which will try to expand this analysis for other cities. Marcos will give more details on that later. The same will have simulations for air pollution at different levels: Europe, Spain, and Barcelona. Also, we will analyze the desert dust. So how the intrusion from Northern Africa is affecting the health, mainly in the Mediterranean countries, but also the intrusion of Saharan dust. It can reach Central and Northern Europe. So this is a factor that affects health and that needs to be taken into account. And finally, influenza will use novel data streams like Google or Twitter searches in order to get proxy data for influenza-like illnesses. And so to be able to analyze at different scales the role of influenza and also COVID in these associations and their contribution to the adaptation trends.
Joan,
So just to sum up, it's just to mention that here we'll put all the factors together in one unique project. That's the strength of the project. And we will use epidemiology and big data analysis to do these associations. And that's all. Thank you.
Fantastic. Thank you so much. I already have questions for you, but we'll keep it for the end. Right now, I leave the floor to María Guerrero. And she's going to talk to us about a project and a current study that they're doing in Barcelona and Badalona about the indirect and intangible damages of sewer overflows. María, do you hear us?
Hello, Judith.
Perfect, the floor is yours.
Yes, can you hear me well?
Maybe if you can get closer to the mic, it would be even better.
Yes, better now?
Better, much better.
Okay, thank you. Well, can you see my screen too? Well,
Yes.
okay, thanks. Bueno, hello, everyone. Thank you for being here today. I'm María Guerrero from Herk, and I'm going to present today a summary of our work on intangible damage on CSO spills from a citizens and business perspective.
María, you're on mute. You have to, can you speak now?
Yes.
Okay, now we hear you. Perfect.
Okay. It mutes automatically, I don't know. But this is part of the, sorry?
We don't see your screen. Now, yes, perfect.
Okay. I was introducing the study, which is part of the RESCCUE project that you may have heard of, since today we are all in the final event of this project. So I'm not going to spend too much time explaining it, only to say that this is a H2020 research project aimed to assess hazard impacts on multi-sectoral urban services and assess their cascading effects. It was carried out in 3 research sites, which are Barcelona, Bristol, and Lisbon. In Barcelona's case study in particular, a complete risk assessment was carried out. You can see here all the climate hazards and damage assessment highlighted in blue were assessed during these 4 years. But today we are going to talk about one in particular, which is a subtle but relevant damage that can help the decision makers to understand better the views and preferences of the final users, which are the citizens. For people who are not in this context, I'm going to briefly explain what is this study. Intangible damage are understood as those damages that are not easily measurable in monetary terms. And in particular, in the RESCCUE framework, is those affected citizens' perception of the nuisance and health risks caused by combined sewer overflow spills and the impact on the trust of the city council. By CSO spills or combined sewer overflows, we understand those events of discharge of stormwater and sewage into the aquatic ecosystem during rainfall episodes, aimed to prevent flooding in urban areas and to limit the amount of flow channeled to the wastewater treatment plant. Here you can see a little graph of what happens to the CSO. It doesn't have to be a big rainfall for it to happen. Just with a small rain, it can lead to CSO spills. So the aim of this study was to provide qualitative evaluation of the perceived health risk of beachgoers and potential loss of reputation of the city council caused by CSO spills and the consequent red flag that happens after those spills. It also supports with valuable information to another parallel study on the economic evaluation of tangible damages to business. The approach followed was to surveys with the beach users and in-person interviews with the coastal business owners to understand their perspective. It was applied simultaneously in Barcelona and Badalona, taking advantage of another adaptation project carried out in the neighboring city of Badalona, the Bingo project, which Rafaela mentioned in the plenary session. The methodology followed was common in these cases. We first did a desk study to understand the affected areas and their historical impact. we consult with the city councils, and we also took some other rescue outcomes, like the dispersion model of the spills in those areas. Then we design and carry out the interviews to the coastal business owners and the surveys to the beach users. And afterwards, we took the results and analyzed them and did the comparison between the two cities. As a general scope, we took only the areas where there are discharge points. So we only interviewed the users of those beaches. To go through the results briefly, we can say that the first answers of the questionnaires show that beachgoers in Barcelona seem not to use to check the status of the beach before going. Compared to Barcelona, there are more than 13 points of difference. And this could be interpreted as either a lack of awareness of potential water quality issues or a lack of interest or awareness of a viable informative means to check the status of the beach before or once they arrive. And the ones who do check use apps and social media to do so, which provides good information to authorities. Then when they were asked what they do if they check and there is a red flag, more respondents change their plans, as you can see. It means that the CSO spills and, of course, all the other causes for a red flag affect the behavior of the citizens and therefore presumably impacts negatively their welfare. There is also another good insight in this question, which is the last answer. The people who answer that they go, and depends how the sea looks, they can swim anyway, which shows that the lack of information about the potential health risk of the contaminated water, the polluted water, can pose a threat to human health, because they may swim besides the red flag if they don't see big waves or a bad sea. They may swim without knowing the potential infections they may get. Then, regarding the knowledge of water pollution as being a cause of red flag, there is a strong difference between the citizens of Barcelona and Badalona. You can see it only 41% pointed out water pollution as a cause of red flag, compared to 68% in Badalona. The frameworks of the cities are different, and it's true that in Badalona this fact is much more present because they are closer to the water, they have a more fishery context in their historically, but also, well, the infrastructure is different, so it's more, the spills are more visible in Badalona as well. So only 25% of Barcelona respondents knew of the possible red flag from CSO spills, compared to the 50% in Badalona. Then, regarding the responsibility of the CSO spills, the beachgoers, they could point out the city council are responsible of these events and the red flag, but only after we explain the functioning of the sewer system and the CSO spills. Then, regarding the results from the interviews to the business owners, we can see that all managers of coastal businesses interviewed knew about the spill events, although their views vary. The sea sports businesses, which activities depend directly on the sea, present the profile of ocean lovers, so they care about the ecosystem, but also about the human health. They know perfectly about the CSO spills, and they could explain to us what they were, and they claim solutions to avoid them, not only informative actions to the citizens. They also complain about the lack of information from authorities, which is understandable. And similarly, the fishermen, the second group, recognize having impacts from CSO spills. And them and the previous group, the sea sports, state that they need to change their routines and incur in monetary losses, but they were not able to estimate a figure. On the other hand, restaurant owners declare that their reservations are not canceled from the red flags, so they are not directly impacted, but they pointed the potential customers that finally don't go to the beach can be missed. And they say the only impact to their business is the potential smell coming from the sea, depending on the wind. Finally, to summarize the perception of the business owners, we have this image in which we can see that managers from the coastal businesses recognize four main points of consequences. And the business that are directly in touch with the water, like the nautical sports, are impacted in not only the economic impact, but also in the human health and the environment. They recognize as important. Then the fishermen find important the 4 points, including the image of the city from these events. And finally, the restaurants that only find relevant the image of the city. To sum up, we found some take-home messages. The main intangible damages found were the overall lack of knowledge about the spills. They may pose a health risk to citizens. The condition of these spills on the behavior of the citizens, and the loss of trust on city council's image from letting the spill happen, especially from the businesses. The citizens rightly put the responsibility on the city council, but mostly agree about their decision on the red flag. And the coastal businesses ask for route changes, not only for information, which also they will appreciate. Then the tangible damages for direct users of water for businesses, but not able to elicit a figure for us. Then the recommendations to authorities that we found more relevant were to provide more information through campaigns and recommendations to users. We recommend to use digital tools for informative purposes, as is the ones more relevant for the citizens, and to improve the communications with the coastal businesses to manage better the spills or their impact. And thank you all for your attention. I hope you find it interesting.
Thank you very much, María. If anyone has a question until now, wait, like that, you can see me, perfect. If anyone has a question until now, I invite you to keep it, to write it down and keep it for later. I already have a lot of questions for you, María. So I'll ask you at the very end. We will now hear from Sebastiaan van Herk. Just before we hear from him, I again invite the audience to not hesitate to send via the chat that you have any questions that you want to ask to the team of panelists. Obviously, we and the rest of the panelists will have our own questions to each other, but it's always better if you take part of this conversation with us. So we now leave the floor to Sebastiaan van Herk, partner and director at Bax & Company, an innovation urban consultancy. He will talk to us about the relationship between urban planning and better urban planning for healthier cities. Sebastiaan, the floor is yours.
Thank you very much. I don't see myself in my presentation, but I want to thank the previous speakers. First of all, because it was very useful for me, because they described the health impact and the climate impact, basically research and work. And I want to make a more practical twist to that and discuss how we can use that to inform urban planning. So basically how to plan your cities considering positive health impacts. So with that, thank you for that, Marcos, Maria, and Joan on flooding and heat. I'll share my screen.
Perfect, we see it.
Thank you. Let me start with the conclusion. For me, this is a resilience conference, and what we found is that actually resilience is actually a pathway to healthy cities. So I advocate that we must make health a driver of city transformation rather than a co-benefit. It was useful to explain that I worked for over 15 years in flood resilience, and we tried all things to improve the flood resilience of a city, to adapt to climate change. But when we then start studying what the impact of our work is, we found that actually health is a very important benefit. So we're kind of turning it around and using urban planning as a starting point for this. I want to, you see two logos on this slide. I want to thank the people working on the Interact North Sea Region City Begin, which are 10 cities and 5 universities, mostly Northern Europe, United Kingdom, Norway, the Netherlands, Belgium, Germany. That's where this comes from. Another project is Healthy Cities, which is led by the city of Vic in Catalonia, Spain, a network of 10 cities working on healthy cities. So this is not all my work, it's their work. A bit about myself. First, relevance is that, so I come from a resilience background, water, but we find that actually other things are equally important. Second point, which is relevant, we are an innovation consultancy, and as such, we develop and manage many international innovation projects. So that's where all these works come from. And of course, we move a bit with societal trends. So particularly now, health is of course a very hot topic, but in general, we find that urban planning, there's a big movement in how we look, how we can design our cities. So we basically jump onto those waves, create new projects. So that's the research you'll see here today. Let me start with a photograph. Try to guess where this is. If we took it in for 2 seconds, you would not guess probably, but this is actually London. This is pretty close to the center of London in the United Kingdom. And it's close to the Tottenham Hotspur Stadium. Why I show you this is the people who designed this and delivered this scheme, they call it a wetland. So these are typically flood engineers originally thinking about, hey, we have a flood risk in the area, so we need to be able to store water, drain water, and so on, and then create something they call a wetland. But as you see, you can already see how this can have many, many other benefits, this place. If you would ask the user of this park, they would probably not use this, no, this is a wetland, rather they use it to walk their dogs, run into it, and so on. I think, so taking basically urban planning, or basically thinking of your, this local situation, how you can improve your flood resilience, we came across a lot of other multiple benefits that we have delivered here. Nicely to mention also is that, for example, this project has been is being maintained by a company called Coca-Cola, which you all know. So it's not just a city pushing for things, but this actually activated many various stakeholders. This is the same park. To give an example of design features, they put in this small area which you could consider almost like a classroom. So we're seated here, and we basically get a lecture for our project, but this is also used by schools in the neighborhood. So they actually have classes outside. So again, what was started as a flood risk project now is a space being used by schools to teach. A very simple design feature, but it looks very good. Also, these same schools, they plant flowers, trees, and so on, and help in the maintenance of this area. Point being, such schemes have multiple benefits. You see, we call them blue-green infrastructure or nature-based solutions. So not just water quantity, but also the water quality, as was mentioned by our previous speaker, but all sorts of amenities and recreation, increased biodiversity, property value, and so on and so forth. We've done a lot of work in trying to quantify these benefits, or even trying to monetize them, to convince cities and all sorts of stakeholders to, when they do something in their cities, to to go for these multiple benefits and also try to use as much as possible such natural solutions. As an example of this is the city of Dordrecht in the Netherlands. They're leading one of these huge European research program, innovation projects. And in their city transformation projects, they actually try to quantify what the benefits are. And as you see on this screen on the top left, to our surprise almost, the biggest benefits were health and social cohesion. And on top of that, the return of investment of this project is almost 5 times, 10 times over if you would consider those benefits. So an investment of roughly 40 to 50 million euro projects, it's a large scheme, could have up to 200 million euros of benefits. Of course, you don't get that as cash in your bank account, but still are benefits. We can dive deeper into how we calculate that. I think that's the basis of a lot of research we're doing. But still, the point I'm trying to make to you is that if these are such important benefits, why not take them more prominently into account when we design our cities? That brings me to healthy cities. I'm a lead expert for an URBACT program, which is led by the city of Beek. And they showed me this, which I did not even know, is 75% of people's, my health depends on the space and the environment we live in. So we often forget that. If I think of health, I used to think 3 years ago about my doctor, but my medical condition depends a lot on my environment. That also gives me a pathway or entry point, because I can design our cities better for health. So for me, this is a very powerful message and a driver for change. You could say that urban planning is a health generator. And that can do in many ways, because urban planning affects your mobility. You can reduce the emissions of cars. You can have more active mobility, so people cycle and walk, which we see now a lot due to the COVID pandemic. Makes people healthier, of course. But also greening your city, social integration, and so on and so forth. So this has many, many elements, but my main message is this: urban planning can be a health generator. This has been developed by the University of Sheffield. There's a report available. You can find a link. You can find the reference in the bottom of the slide. They said, hey, if we take blue-green infrastructure as a starting point, which we did for our flooding work, what other benefits could it have for health? And so they split the attributes of blue-green infrastructure into greenness, aesthetics, and physical accessibility. Of course, if there's green, you can have cycle paths, walking paths. It looks nice, and the greenness of itself also has positive impact. So, well, they looked at what health relevant impact this has as the center column, and what health outcomes this could have. It's a relatively simple diagram, but gives you a bit of an overview, and it links back to other speakers. So when our colleague was talking about heat stress, well, if you make your city more green, you can reduce the heat stress, as well as the air quality and so on. Of course, physical activity leads eventually to healthier body weights, improved birth outcomes, and so on. I think the diagram is pretty self-explanatory. Then this kind of overview has been converted into design tips. So if you are an urban planner or an architect, or you're a strategist for your city, then okay, if I'm going to use blue-green infrastructure, which we kind of advocate most of the time, is how can you design for improved air quality? So what type of green should you use then? How to combine it with other measures? How to design for noise reduction? I mean, you see some specifics here, but maybe thanks to the green, you can reduce the noise by 9 to 11 decibels. Of course, this type of work, we just saw a presentation from IS Global. They're actually very good at this, so I recommend you talk to them. But what we are doing is taking all that knowledge and converting into design principles for cities. So how can we use all that knowledge to actually create that positive health impact? as well as positive climate adaptation. So here you see improved air quality, noise reduction, heat stress, but we also have tips for social inclusion and other benefits. This is similar work. It looks a bit more thorough. It's done by the University of Wiek and the city of Wiek. They took hundreds of scientific papers and tried to relate what they call urban determinants. So basically your planning, your design, to health indicators. So an urban determinant can be related to traffic, to landscape, to the density of your city. And they looked for studies on which part of urban determinants could be linked to what health indicators: physical health, mental health, societal health, as they call it. So you understand kind of the logic of this table. But to make this practical, they actually tried this out first in the city of Wiek, which they're really front runner. I recommend you go there. I hope possibly the architect is also in this call. They do it together with the Diputación de Barcelona, which is the regional government. And they thought, okay, we're going to make a new master plan for our cities with quite some transformational projects. And let's see how we can improve the health through all those measures. So basically, it was health informed. But on the other hand, once we make the plan, can we see how much impact on health it will have, and can we improve that? So you see here 2 images. Of course, there's a lot of work behind this, but I want to show you the concept of how they work.
Sorry, Sebastiaan, just to tell you that we have one or 2 minutes left.
That's enough. Yeah, thank you. So basically, they took the urban plan, looked, hey, this urban plan increased walkability, it improves open public spaces, and that then leads to, same study, hey, that leads to more physical activity, less overweight, less air pollution, and a more emotional well-being. So they could easily relate their plan to health impact. You can discuss a lot about these numbers. I think it should be improved also, this methodology, but it all starts to quantify the health impact of your planning measures. So I go back to the conclusion, Chairwoman, Judith, thank you. So for me, urban planning is a pathway to help with these cities, but also resilience was my starting point, because to increase resilience, we started planning our cities in a different way, using more blue and green solutions. And we actually find that health is a very important positive impact. So maybe even try to design a city more healthier. So thank you for your attention, and open for questions.
Thank you very much, Sebastiaan. So we are entering the phase of questions and answer. Thank you for your presentation. I don't know if the audience has written any questions. Maybe from the organizational team of URCC. Monica, do you have any questions to share? Okay, so it looks like no. Well, I have some. All of you actually talked about vulnerability, and I was very curious of knowing, I mean, especially on the first topic, early adapt, Joan. Let me start with you, but in the same time, I mean, feel free to interrupt myself, and let's have an open conversation all together. So, Joan, when you said you were going to estimate vulnerability, can you tell us more about how you plan on doing this? You are on mute.
Basically, it's by using epidemiological models. Maybe the word vulnerability, it's something I didn't define, and I was assumed that it would be understood, but there are different definitions of vulnerability. The one that we normally consider is the one that is in line with the IPCC, the Intergovernmental Panel for Climate Change, and in which they divide an impact in 3 components, which is vulnerability. So one given, well, vulnerability, hazards, so any kind of adverse event or extreme heat wave or flooding, etc., and exposure. So you have a population, which is exposed population. Then you have a frequency of these events, and each exposed population has a degree of vulnerability. So if you don't have an event, you don't have any kind of bad outcome. If you don't have exposed population in the place where the event is taking, you don't have any bad outcome. And if the population is not vulnerable, so it's not affected by that, they don't have any kind of, so it's a kind of product between the three. So vulnerability is defined as a way to, the extent to which some event in a given population that is exposed to this event is affected by this by the event. And it depends, of course, on the population, of the social groups of the population. And there are many epidemiological techniques that are used. One of them is the one that Marcus explained with very technical details. It's a very complex technique, but they are epidemiological models driven by data, health, and environmental data, in which they are fitted. We use these models to fit the data and then to get these associations, and that's how we extract the vulnerability.
There is actually a question that was asked for you, so I'm just going to read it. It's very impressive to see the decline in relative risk of extreme temperatures in the past. I'm curious whether there may also be a change in the optimal temperature.
There is. Actually, one of the results of the papers that I showed, that was led by a PhD student, Ishama Shevak, is that the point of minimum mortality, it's something called MMT, minimum mortality temperature, is the temperature at which we have minimum mortality or minimum risk of death. This point, this temperature, has been increasing, at least in Spain, to the same extent as there has been, as the climate has been warming. So during the last 3-4 decades in Spain, temperatures have increased by 1 degree. And this point of minimum mortality has been shifting by 1 degree also, in parallel with the warming itself. And this is a sign that maybe the society is more capable to deal with these warmings than we originally thought. That does not mean that this will continue to happen as the temperatures start to speed up. But at least for Spain and for the period that we have observed, there was this very parallel behavior between temperatures and minimum mortality temperatures.
Actually, there is a very interesting question that was asked by Sebastiaan, and I allow myself to say it. What do you think, in your opinion, Joan? But I open the conversation to all the panelists. Okay, Marcos, María, you're welcome to join the conversation, obviously. What urban planning measures do you think could help adapt to those climate change consequences? Mortality included, obviously.
Do I answer? Yeah. Okay. Measures. I haven't seen. I mean, measures, if they refer to the design of the city and not to the physical variables associated to heat stress, I'm not aware. It's not my area of expertise. I'm not aware of measures that have been designed, but they are associated with social measures like poverty, deprivation, type of building, how old is the building, there is in our institution, there is a whole line of research about green and blue spaces, and in which they have been describing the proximity to these green and blue spaces as a way to reduce risks. For example, because they reduce the stress, and so this has benefits for the circulatory system of the body. So if we had to design social indices, it will be related to that.
Yeah, I was actually thinking about it because for another project, I know that there is a certain number of people in energy poverty in Barcelona, and I was wondering actually if all of this could also be fought through energy efficiency measures. I mean, when we're talking about heat waves, it's going to affect the population if the population can't actually be living in a certain level of comfort in their home, which means heating the home obviously in the winter, but cooling it down in the summer. So if you don't have green areas to be able to, as you say, breathe and relax from the heat, it's going to be inside your home.
Full poverty, it's another index that is often taken into account. So the limitations of access to air conditionings or heating systems. That's also an important measure.
Sebastiaan, there was a question for you from Joan Guerrero, who wants to know why Coca-Cola was sponsoring that area of the project that you showed us, and wants to know what was their interest.
Good question. I think there's always a part of corporate social responsibility. So I think, but that is, I think most importantly, their offices are close to the area. So I think an important amenity for a worker is to go out for lunch, have a walk. No? So actually the workers use this space. And also I think personally also as a business owner, it's kind of rewarding if you contribute to your environment. And I think workers also enjoy that. So I was so compliments to this big corporate organization who contributed. I think it's something the workers enjoy. They use the space. So they use the space and enjoy working on it. So I think that's the main reason. There's no financial benefit, of course. Maybe there's a bit of greenwashing. I'm personally not against that, but yeah.
So if I may, the rest of the question from Joan Guerrero was, and please don't tell me it's greenwashing. So Joan, I'm sorry. It looks like.
That was not the answer. The answer was that the workers use that space. So
I'm sharing with you the rest, the comment of the question. I actually have a question for María. María, I was quite amazed by the topic of your talk, because to be fair, I really thought that sewage water, that it was illegal to direct sewage water immediately into the sea. I always thought that obviously we had treatment facilities.
We have very good treatment facilities, but it's actually illegal. It's under the European Water Framework, and it's allowed to have this. It's not directly sewage water, only it's the combined rainwater and sewage that goes out after a certain level of rain, because the treatment plant doesn't have the capacity to treat all the combined water. It's designed for dry weather. And there are measures that the city council is evaluating as part of this and other projects to alleviate that or to directly stop the discharges into the seawater, like retention tanks, where the storm water and the combined water is storage in a tank until the rain stops and the treatment plant can process it slowly, or the use of nature-based solutions to alleviate to increase the drainage of the water through the surface.
Can you give us an idea of how many times during the year this is happening?
Every time it rains.
Every time it rains?
Yeah.
So wait, every time it rains in Barcelona, the treatment facilities, the water treatment facilities are incapable of treating the water and directly spilled.
Not all, just depending on the amount of water. Certain, like you saw in this drawing that I show, certain amount of water goes out to the sea. It doesn't go directly to the beach. It goes through some pipes of 200 meters deep in the sea, so it doesn't go directly on the beach water. It goes a bit deeper in the
Sorry,
sea.
when I mean the beach, I mean the sea. It goes into.
In other areas, it goes directly to the beach. That's why it's more prominent in certain places. But not all the water, only the water that the design of the sewage system is not able to treat.
Well, I don't know if the other panelists knew about it. I am personally very surprised. Did you know about it?
Yeah. I only knew about it when I started to work in this project. I am an environmental economist, so I'm not a engineer, and it was shocking as well. But you can see people who go to the beach here in Barcelona after a day of rain. You can see it doesn't look too good.
Sorry, I'm gonna read a comment from Sebastián. There is much discharge nearby in Badalona. You're not surprised about their higher awareness.
Yeah. I try to explain it in a nicer way. Badalona, the water is one of the places where the water goes directly in the beach. That's why everybody's
More, actually, you went really fast, but I saw the amount of points of discharge points that were in Barcelona. Are there more points in Badalona than Barcelona?
There are, well, no, Badalona is smaller, so there are less in general terms. But in Badalona, they go directly by the beach, so they don't go with pipes to the sea. That's why it's more relevant there. But they are taking actions right now through bingo projects and other actions. They are trying to reduce that and get rid of those discharges because
The bingo project, sorry, the bingo project is a European project, right?
yeah, it's another H2020 that finished just last year. We were also involved with LENEC, also Lisbon, and other partners. And that was one of the main study points in Badalona.
Thank you, María. I have two questions that arrived. The first one is from Pierre Modou and is for you, Joan, about the Early Adapt project. So Pierre wants to know what will be the final product of the Early Adapt project and wants to know if it will be something like a real-time online dashboard accessible by the public. And he thanks you all for your very interesting presentation.
Actually, the ERC funding scheme, they discourage practical research. So it's about theoretical research. So you can generate products, etc. And actually, one of the things that we've been doing, it's an early warning system of heat-related mortality, but that's in the Blue Action project, which is about to finish, and which Marcos has also been involved. So we plan to continue these kind of things. One of the main outcomes of the project will be detailed maps of the risks of death or risk to given health outcomes, so hospitalizations, occupational accidents, etc. Maps that are available for each environmental exposure, and also maps of the role of each of these socioeconomic drivers, and also projections of climate change adaptation. But this is just one of the products, consequence of the theoretical research that we'll be doing. But this kind of outputs will be at the end of the project. But I must warn that the ERC projects are by definition high risk, high gain. So unexpected things happen, and for sure will happen. And so the kind of things that we will deliver, it's something that we don't have to plan when we write the proposal. It's something that actually we are discouraged to plan, because it's very unlikely that what the idea that we have in mind during the proposal phase matches with the thing that we will finally do.
That happens at the end, but whatever happens at the end will be available to the public, right?
To the extent that it's not constrained by the loss of the data providers. For example, the Instituto Nacional de Estadística, the INE, the statistical units for, the statistical office for statistics in Spain, they do not allow to share the original health data sets to third parties. So we must be very careful with that, because that's legally binding from the data providers.
Sorry, Sebastiaan, just before you go, there was just a second question that I want to ask to Marcos. Can you keep yours for the very end? Marcos, there is a question for you from Mar Satoras. Also congratulating all of you for the very interesting studies. She wants to know if it is possible to show changes or certain patterns over time.
Yeah, something that Joan also have seen have shown in his presentation, that we can see changes in over time, but we have a not very long time period, so it's very difficult to see differences over time, because we need to subset some years. So if we have only 30 years, maybe the subsetting of these years is not enough to do these changes over time. But I don't know, maybe with the data we have in the future, we have more years, and we have the possibility to change also differences in the over time in the pattern of Barcelona or other cities.
Okay. Thank you, Marcos. Sebastiaan, what did you want to ask?
Yeah, thank you. I want to bridge some questions. The question of what Joan said, they do more fundamental research. I think what we're now creating is a new set of projects where we bridge their very interesting work to more the practicalities. And so you asked about a dashboard. We already have scoreboards of designs. We're now going to more dashboard because we want to link it more to the evidence, like the real data that Joan and Marcus are doing, trying to put it into design. And it goes as far as that we're now thinking of a project where you do artificial reality. So basically you have the idea, you cycle to an area which is designed, it's not there yet, and you can actually see the changes in air quality, which is not real, of course, but then for awareness raising, kind of using their more basic research and putting it to practical use. So I think that's basically our dream, to bring this together in the next, let's say, 5 years or so, work on these kind of things, because it's nice to evaluate the design and make a scorecard, but it's even better, as the attendee asked, to have a kind of a dashboard where you could see what happened. That's one. On the question for Marcos, we also really want to do scenario planning in our design. So not just make a design now, but okay, what if the demographics change, the climate changes, or epidemic? So on the different scenarios, how would the city perform? I think that's also still an area of much research and practical. There's practical need, because you don't want to lock in the design in your city and build infrastructure, and then you have to change it 10 years later. So for us, it's very interesting. Their outputs for us very welcome.
I have a question actually to all of you, because it does indeed look like the population that are going to suffer the most the impacts of climate change are going to be the very urban population. So do you plan on living in a city in the next 10 years? Who starts? Do you actually live in the city, or do you live outside?
Yes, in the city. Just to open the focus, the populations that are going to suffer the most are those from the poor countries, not only for heat, but also infectious diseases, etc. So either they are rural or urban. If we compare with our reality, it's a completely different story. Regarding city and rural for heat in Europe, it depends on the health outcome. It depends on the situation. It's not necessarily the case that the fact that we have an urban heat island effect in the cities, it leads to higher risks in the city itself. So the populations have a high capacity to adapt to different circumstances, and especially this long-term capacity, which is the one that has been happening during the last centuries. So populations are adapted to the climate that is typical. Now we have a different situation in which we are rapidly changing the climate, and then we have to adapt as we warm the climate. So that's a completely different situation, because we go behind the warming. But for example, somebody living in rural areas in the Mediterranean maybe are more vulnerable than people living in cities in Central Europe. So it's not necessarily the case. It's very complex.
Okay, Sebastiaan, yeah.
I like the personal angle of your question. I have 2 children and I live in the city, and I actually thought about these things. Maybe that's professional deformation, but how is it? Is this health? My eldest son had a lot of bronchitis, and I said, should I live in the city? And if I cycle them to school, I try to take the greenest route. You know? So of course that's safer, but it's also somehow healthier, not as warm. So I think even ourselves as professionals, we're also citizens. And so yeah, I have considered moving out of the city. It's not happening, but at least while I'm trying to adapt my lifestyle, especially for my children, to keep it to that. If that was the kind of question you asked, but
yeah, no, definitely it's gonna. I mean, I think it's gonna be a real issue, and it's a trend that. I mean, I see personally. Obviously, I have no study to back up what I'm saying. But that's a trend that I actually see happening. Most of the people who have actually higher income and can afford to leave the big condensed cities prefer to live outside and come to the city just to work. But let's see what the future holds. Anyway, so we are reaching the end of the session. I want to thank you very much, all of you, for the great presentation and the very interesting conversations. I hope we're going to have the opportunity to do another one. Let's say in a few months, or maybe in a year. We'll have to talk to the URCC organization team. But those are topics that are very interesting to watch and to keep on follow. So thank you again, everyone. And yeah, let's keep in touch and continue talking about those topics.
Thank you so much.
Take care.
Thank you.
Ciao.